Mayo TD is concerned about the loneliness and isolation felt by many elderly people in nursing and care homes who are unable to see their families during the current COVID restrictions. Sinn Féin TD Rose Conway-Walsh raised the issue with the Taoiseach recently to ask if there's more that can be done to enable family visits in a safe way. The Eris TD is asking that the government look at safe protective practices in other countries and explore ways of providing a limited number of designated visitors who could visit their loved ones in homes following strict protocols. While commending the work being done in nursing homes at this difficult time, Deputy Conway-Walsh told Midwest News that she's concerned about the impact of no visitors on elderly residents.
I am, Paula, and that's why I raised it with the Taoiseach last week. And I was asking him, could we do more to facilitate restricted family visits while obviously adhering to the public health guidelines from the Health Protection Surveillance Centre. And what prompted me to do that, Paula, was the number of families who are contacting me to say that the months and months have gone on and they haven't seen their loved ones in nursing homes and in care homes. And
but there was some visiting permitted when we were at level 2 restrictions.
There was some, but now we're into level 3 again, and I just think that there needs to be more thinking outside the box. And as one woman said in her family, did I ever think I'd be all alone in this world at 92 years? So there's an awful lot of heartbreak and loneliness there within nursing homes.
But given the number of clusters we've seen in nursing homes, obviously management will do all they can to ensure that the infection doesn't enter the premises.
For sure, and I want to commend all of the great work being done in nursing homes, and particularly in terms of the healthcare staff and the healthcare assistants and the nurses to do that. But I still think there is more that we can do. And what I was asking him is, can we look at the safe protective practices that are used in other countries to be able to allow some restricted visits? I'm not
Such
talking
as?
about... winter gardens, for instance, if heaters can be put outside even, and it depends on what the nursing home's infrastructure can lend itself to. So if you could do a winter garden that was protected, if you could have the PPE for families, if you could have the situation where you'd say to families, right, you designate a member of a family and they will dress up in the PPE gear, they will have a test beforehand, and to make sure that the infection control measures are there. I just think that those things can be done, because I'm really concerned about the loneliness that people such as that 92-year-old woman is experiencing at this particular time.
What was the Taoiseach's response?
Now, he didn't. He talked about music and entertainment for people within residents within nursing homes, and I take it that nursing homes are doing everything possible in that line. But there's nothing like family contact. If you think of an elderly
and in fairness, they are trying to facilitate that with tablets and video calls and so on.
They are, but I think as human beings we all need human contact, and if that can be facilitated, I think we all need to work together to ensure that we are doing everything that we possibly can to be able to facilitate some visits within nursing homes in a really safe way.